Great. Hi there, I'm Taryn Etchegoyen from the YWCA. I manage the counseling center there. I'd like to introduce Amy.
Hi, I'm Amy Porter. I am the legal advocate manager at the YWCA.
So we're going to go over what hospital protocols look like surrounding domestic violence. Let me try and screen share. Go. Perfect. So we do have a hospital response program for hospitals in the Spokane area, and we want to equip hospital staff, medical personnel to be able to appropriately respond to intimate partner domestic violence.
Okay, so who we are the YWCA Spokane. We're a nonprofit agency and we are a victim service agency, which means that we work with victims or survivors of intimate partner domestic violence only. We are based downtown Spokane in what's called the Family Justice Center. So the Family Justice Center also houses law enforcement for Spokane City and County in the domestic violence unit, as well as city prosecutors for the domestic violence unit, as well as all of our programs that we have at the YWCA. So some of those programs include our confidential safe house. We have counseling and therapy. We have legal assistance in the form of legal advocates that help with protection orders in criminal domestic violence cases, as well as family law attorneys that can help with parenting plans, divorces, and family law matters. We also have a prevention team that works a lot with youth to educate them about domestic violence. We have a Women to Work program that helps with job placement for survivors. We have CSO advocates that help with survivors who need state benefits. And then we also have our Sisters Closet, which is a free clothing boutique for survivors to use. A lot of times if people are fleeing a domestic violence relationship, they will leave in the middle of the night or in a situation where they're unable to grab any of their clothes or necessary belongings. So we want to be able to provide those things for those survivors as well.
Great. So understanding what domestic violence is an important part of being able to help survivors. It is a pattern of controlling behavior, obviously using power and control in a relationship, one person over another in an intimate partner situation. Obviously, this is not all physical. In fact, most of the time, it involves many aspects such as financial, spiritual, sexual, cultural, emotional, and verbal abuse. It can be difficult to ascertain if somebody is actually undergoing, but you can pay attention to if you hear people saying things like some of the phrases on the right-hand side, calling them stupid, belittling people, letting them know they're worthless, being too controlling. And I think it's really important here to understand that domestic violence is not an anger issue, and anybody can perpetrate to anybody else, no matter the gender, the role, or anything like that. It is a very calculated way of controlling a partner that can be done by any human to any other human they're in a relationship with.
Okay, so more about domestic violence is the cycle of violence. The cycle of violence talks about the dynamic that happens within a domestic violence relationship. So the first stage in this cycle is often tension. This will look like the perpetrator giving the victim a lot of criticism, yelling at that person, swearing at them. You'll see manipulation, a lot of anger, and people will typically describe this stage as walking on eggshells. After the tension stage, we go to the explosion stage, which is typically going to be a big blow up or a violent act. This can include attacks, it can be threats, this can be emotional, physical, and all sorts of different realms. And then there's the honeymoon phase after that. So once there's this big explosion, the perpetrator will try to make up for what happened by apologizing a lot, promising things. They're also going to be blaming the victim, making them think that it was their fault. They're going to be giving gifts, doing all sorts of things that make that person want to stay in the relationship. In addition to the cycle of violence, there's the don't ask, just tell model. This explains a lot of the reasoning behind why survivors might be hesitant to come forward when they're experiencing domestic violence. And this can mean that they're hesitant even when they're asked directly if they are experiencing violence at home. So some of the reasons they may not want to talk to you about the domestic violence they're experiencing is because they're fearful of retaliation. Their perpetrator is often going to be making threats that they will do terrible things to them if they tell anyone about what's going on. They may also be afraid for their child's safety. The perpetrator could be making threats to harm the child or take the child. They also oftentimes feel like they have no other option. They rely a lot on the perpetrator in most of these situations. Isolation is a big part of domestic violence, so they're relying on that perpetrator for any type of money, housing, transportation, childcare, social connections, all sorts of things. And so they feel like if they're not with that person, they have nothing and they'll just be homeless, or the perpetrator will be so emotionally abusive to them that they feel like they deserve this and they have no other option because they won't be able to find another partner in the future. So prevalence of domestic violence in Spokane County. This is really important. We have very high rates of domestic violence here. So the rate of domestic violence offenses in Spokane County found by the Spokane Regional Health District is 10.4 per 1,000 people. The Washington State average is only 7.4 per 1,000 people. So as you can tell, we are quite a bit higher. It says 23% of Spokane County youth reported witnessing adult violence in their home as well. So this would be seeing a parent or a guardian that is either perpetrating or experiencing domestic violence while they're there. Additionally, 9.4% of youth have experienced dating partner abuse themselves. The End the Violence campaign in Spokane also found that Spokane County has the highest rate of domestic violence within the state of Washington. And additionally, they found that domestic violence is one of the leading causes of homicide within Spokane County as well. So it's very lethal, very dangerous, and very prevalent here in Spokane. Okay, so the lethality assessment protocol is something that we currently do with law enforcement, both with the city and the county of Spokane. This is a program that we're trying to get up and running to do a similar process with hospitals. So how it works right now with law enforcement is any domestic violence call that law enforcement goes out on, even if they're not able to arrest somebody, they're going to ask the victim in that situation a series of 11 questions. These questions are going to be pretty difficult questions to ask. Questions about, do you think that perpetrator will kill you? Have they ever threatened to use a weapon against you before? But these questions are really important because they determine the lethality of the relationship that that person's in. So a person can either screen into the lethality assessment or not screen into the lethality assessment. If they screen in, it means that they answered 4 or more questions with a yes answer, showing us that there is a risk of lethality in their relationship. So when somebody screens in, the officer will then right there on the spot put that person on the phone with one of our crisis line advocates. It's 24/7. They are then going to talk with that advocate, and the advocate is going to do immediate safety planning and resource brokerage with that person. They can address whether or not they need to get into our safe house for the night, next steps, all sorts of things. And then it gets flagged by the legal department, which is where I work, for us to do a follow-up call with that person the next day, just to check in with them, see if we can connect them to any other resources, talk with them about a protection order, or if the perpetrator was arrested, we can also talk with them about the criminal case and what's going to happen next with that. So this is really important and has worked really well in Spokane County as well as across the nation by different departments that are using it, because it keeps that victim connected to resources and it gives them additional information instead of just having that one interaction with law enforcement and then never having anything else come of it again. We're trying to make sure that we really get in, that we're there for them, that there are supportive resources so that if and when they are ready to leave, we can help them.
Exactly. So as Amy said, we're trying to implement this in the hospitals around the Spokane area. We currently have this model of the hospital lethality assessment program tool. It's on cardstock, and I know you have to tilt your head sideways, but you can read some of these questions. These are evidence-based questions that if somebody answers yes to, there is a high likelihood of lethality within their relationship. So these are hard questions to ask. We'll give you some tools later about how to respond if somebody does say yes. We also love using personal judgment. So if you get no's to all of these answers, but you also really think that there is a chance that domestic violence might be happening, you can always ask your patient or the person in front of you if they would like to get in touch with one of our helpline advocates. When you call the helpline or have the patient call the helpline, they will refer to hospital response, and hospital has their own online phone call. It's 24/7, and we will get in touch with the patient at the hospital. It's really important to understand that we follow the empowerment model. So if a patient is not wanting to get in touch with us, do not get them in touch with our program. We want to make sure that they feel empowered. As we talked about earlier, one of the things about DV is that the power is taken away from the person that is being victimized. So giving that power back to them is a great first step. If they don't want that in the moment, you can still give them the phone number and they at least know that there is a resource in Spokane. So understanding the impacts on patients and families when DV is involved is really important. Short-term impacts are loss of financial support, employment issues, loss of housing, loss of childcare. You can imagine these are all very scary things, and this is why a lot of people don't leave the situation. They need employment, they need housing, they need childcare, they need financial support from their partner, and it's very, very difficult to leave that situation. Some of the things that you might not think about are the mental health issues, PTSD, anxiety, depression. This being in a constant fight or flight response mode, it does awful things to your ability to try and focus, sleep, function, day-to-day normal tasks become difficult. Shame and guilt are often taken on by the person that is being victimized. They try to take responsibility for their perpetrator's behavior. And also, you have to think about the criminal and court system. If there is police called, if somebody is getting a protection order, or if there's a criminal background, it takes a lot of time and effort to go through the court systems. It feels like a foreign land. It's very, very difficult for survivors to try to navigate, especially in this constant fight or flight state that they're in. Long term, with some of the short-term things leading into the long-term, obviously a poor employment history doesn't help you get a job anywhere. Evictions or poor rental history, especially in Spokane with the climate being the way it is, it's almost impossible to find a place to live. Poor credit can happen really, really easily through all of these ways. Obviously, child support, custody, you can still be victimized. You leave, you finally make the decision for yourself to try and get into a better situation, and your children can still be used against you in the court system. This can lead to like large mental health issues, complex PTSD, and we know that being in that fight or flight response mode for so long can cause chronic physical health issues. And obviously it changes the way a person sees the rest of the world. Individuals and even systems, even hospitals, CPS, things that are supposed to be there for you often work against you, and it makes it really hard for patients and other people to trust that the help they're going to get is actually helpful. Right, so this is the power and control wheel. It gives some really good examples of how somebody can abuse another person. And I think that a lot of people are surprised when looking at this of the things that they've actually experienced themselves or they've witnessed friends experiencing. It can be a really difficult wake-up call for a lot of people, but these are some great examples: using intimidation, emotional abuse, putting somebody down, making them feel bad about themselves, isolating somebody, controlling what they do, who they're with, showing extreme amounts of jealousy, limiting who you can go out with, even keeping people away from their own families, denying, minimizing, blaming. Oh, I didn't do that. It wasn't that bad. It won't happen again. Economic abuse is a huge one. Threats, coercion, all of it. So these things make it really difficult for victims to want to come forward. But understanding how some people present during this kind of abuse is really important. You can notice this maybe in your colleagues, patients, anybody that you've met with. You can see personality changes. People skip work, they skip school. Somebody who's usually outgoing and likes to go to certain events is no longer going anymore. They're on their phone, constantly checking with their partner, worried about what their partner thinks, makes excuses for their partner's behavior. Oh, they didn't mean that, etc. Substance abuse is also another thing. People self-medicate and they get what they can to make themselves feel better at the time, and it's unfortunate, but it's a side effect. Wearing clothes that don't fit the season, long shirts, turtlenecks, that kind of thing. Those are all pretty good warning signs to be aware of in the people that you care about.
Okay, so if you are working with a patient and you realize this person is a victim of a crime, but not necessarily intimate partner domestic violence, there is another agency in town that we work with very closely called Lutheran Community Services. As we only do intimate partner domestic violence assistance, they catch pretty much everybody else. So Lutheran Community Services Northwest, they have a crisis line that's 24 hours. And they also have a hospital response program. So they focus a lot on assault, harassment, bullying, elder and parental abuse, sexual violence, and assaults of any kind. And they do have a SANE nurse that can respond as well. They do property crimes, sexual exploitation, child abuse, child sexual and physical abuse, burglary, arson, hate crimes, kidnapping, terrorism, mass violence, and vehicular assaults.
Perfect. So we talked about earlier, asking those questions on the lethality assessment protocol paper is very difficult, or even if something comes up in conversation, being equipped with knowing what to say and how to respond to somebody is really important. Making sure not to victim blame, making sure not to make any promises that you can't follow through on, like I'll get you out of this situation, but saying things like you don't deserve this and being genuine. You're not alone. I'm sorry this is happening to you. I believe you. It's not your fault. If you don't know what to say, I don't know what to say, but I'm glad that you told me. Being there for somebody and knowing that you're that safe place, you're that safe person, you're not judging them in that moment can be everything to a survivor that is thinking about making steps to get in a better situation. So I know that we deal with people from all over the world, right? On a regular basis. There are a lot of immigrants in Spokane, and there are a lot of cultural competencies that are difficult to navigate, right? We don't know if this is just normal in their culture, or if this is behavior that we should be concerned about. It is important to understand some of these facts. Immigration does disrupt family and social networks. You leave your country and you come to a new country, you are now more dependent on your partner. Maybe you don't speak the language, you have no friends, no family around. These things are dangerous for somebody that's already undergoing domestic violence. It can get a lot worse in situations where you're moving into a new area and 100% dependent on your partner. Partners often threaten deportation, don't file the appropriate paperwork, destroy identification and immigration papers. You can lose custody of your children through this. You can be threatened to lose the custody of your children through this. It's really important to understand that cultural norms may prevent women from attending school or learning a language prior to even coming here, or working outside the home is not normal, and creating a new social network when you get here becomes almost impossible. Male-dominated marriages have been found to have the highest level of violence against women, and unfortunately, this can carry over, even moving into America. So foreigners in a new country, men come here, they may have had a great job, or even women may have had a great job prior, they come here, and now they are no longer at the same social status as they were prior to moving. They are faced with unemployment often, and people who are faced with unemployment and don't have a job to lean on are also known to be higher likelihood of being a perpetrator. Really, the only things you can do in this situation, because you cannot be culturally competent with all cultures, but we can try and have an awareness that of their values, their belief systems, and their biases, and knowledge that our clients their values and beliefs and cultural practices are different than ours, and having a curious approach to it is important. And then trying to find the trainings and finding the ways to navigate different cultures through using local resources.
Okay, so what are DV advocates? Domestic violence advocates, we are a team. We are completely confidential. We are there to be supportive, to offer resources, and to help a survivor get through the healing they need to and get to safety. So to get connected to an advocate, we have our 24/7 helpline that you will call, that is run out of our safe house. We again provide legal advocacy at the YWCA where we can help with protection orders and also assist somebody through the process of a criminal domestic violence case that they're the victim in. We have attorney services for free. Those help with, we have family law attorneys, so they do divorces, parenting plans, any custody issues, all that kind of stuff. We also have a counseling department. They do advocacy for youth and adults. So if your kiddos have experienced domestic violence in the home or witnessed it, we have advocates that can work with them as well. We do have a support group that takes place every week. And we also have housing advocacy. And so that support for people that are experiencing homelessness or housing issues due to domestic violence, maybe an issue with a landlord who's trying to evict them because they were a victim of domestic violence, all those sorts of things.
I think it's important to point out something that I meant to mention earlier is that we understand that everybody that works in the medical field is a mandatory reporter, and so are we. All of our advocates are as well. And DV is not a mandatory report in and of itself. If it's happening against adult with vulnerabilities, like APS can be called if somebody has different learning disabilities, etc. Or if somebody has a child in their hand while a violent act occurs, that is CPS reportable, but all other offenses are not, which it's a double-edged sword. It can be good or bad depending on the situation, but a lot of times reporting these kinds of abuses can make the situation a lot worse for the victim. So that is important to understand. And that is the end of our presentation for today. Thank you for listening.